understanding basic statistics to interpret findings and create tables and graphs for quality improvement. The objective of this lesson is to describe and understand the common statistical tests and to develop the skills to interpret the results of statistical analysis. So what are basic statistics? There are three types of statistics: descriptive, basic, and regression models. Descriptive statistics are means, medians, modes, variance, and standard deviations, and percentages. A mean is the average of all the values, and it's the most common way of describing central tendency. It's the sum of all the numbers and the total divided by the total number of values. Here's an example. A median is the score found at the exact middle of a set of values of data. It's a measure of central tendency. Here's an example of these 5 numbers. The median in the middle is 85. If you have an even set of numbers, then you don't need to take the average. You need to take the average of the 2 middle numbers. And the mode is the most frequently occurring value in a set of scores of data. It's the third major statistic used to measure central tendency. As you can see in this example, the mode is 85 because it occurs 3 times. If you have more than one number that occurs equally, then you have a bimodal distribution. We also look at variance or standard deviation. We have to do this so that we understand how the spread of the values are distributed. Where variance is an estimate of the average variability of a set of data, standard deviation is an estimate of the average variability of a data set measured in the same units of measurement as the original data. So basically it's a square root of the variance. And then there's percent, which is commonly used in quality improvement. It's used to describe distribution of variables. It gives the amount or percent of the individual fall into a certain category. Here's an example: 35% male and 65% female. Note, that equals to 100%. And then there's basic statistical test, t-test, chi-square, and correlations. In QI, t-test and chi-square are the most commonly used. So t-test assesses whether the means of 2 groups are statistically different. Usually 0.05 is the significant p-value. On the bottom here, you can see the histogram and normal plot to show representation of a t-test result. And here's chi-square. It's used to determine if the distributions of categorical variables differ from one to another. It tests 2 variables that are independent, and it tests a hypothesis. An example is the likelihood of developing diabetes is the same for men or women. And correlations are a measure of the linear relationship between variables to determine if there's a negative or positive relationship. If there's a relationship between 2 variables, then it's as one variable deviates from the other. This is not often used in QI. There are also common tests for correlation: Pearson R, Spearman Rowe, and Kendall Tao. And this is presented here if you do need to use a correlation, but as I said, it's not a common statistic used in QI projects. You also have to know how to interpret correlation results. And this is how you interpret the value of R. And then there's ANOVA, analysis of variance. We use it to compare 2 groups or variables. You can't use many t-tests to compare the groups because the likelihood of making an error increases. For example, when you're comparing the pain level of post-hysterectomy patients with the PCA versus oral medication versus needed pain medication, you're comparing time needed for ulcer healing between subjects who receive a wet to dry dressing or a duoderm or a wound pack. So ANOVA can be used in these examples. All ANOVA can tell us if there's a significant difference between the group. It cannot tell us if one group was affected more or less than the other. It's useful for initial statistics to determine if there's a difference between groups. There's also regression models. They're helpful for determining if a score or characteristic significantly predicts the outcome. It allows for the introduction of other characteristics that may also impact the outcome. Here's an example: wound healing time. You take the smoking status of diabetics who have wound care, an infection, and their age so that you can understand overall what occurred. There's also linear regression. It's where an outcome that's continuous, like days of wound healing or pain score or depression rating scores, can be examined in a simple way or in a more complex way. So the simple way is the pain score for the gender, but a complex way would be the pain score where you look at the gender, the race, the type of surgery they had, and the type of pain medication to better understand the overall patient. So linear regression results have variability, variables that are significantly impact the outcome. They're presented as B coefficients. If the predictor is categorical, you can compare the different groups. There's also logistic regression, which is an outcome that has two or more categories that's dichotomous. Here's an example: pain, yes or no, or wound healed, yes or no, or patient depressed, yes or no. You can also do 3-level: mild, moderate, or severe pain. So that's called multiple or multinomial. You can use a single characteristic or multiple characteristics as variables. So we use, when you use logistic regression, there are certain rules, one of which is the outcome needs to be normally distributed or continuous. If we try to use linear regression for a category outcome, a predicted outcome may fall outside of the category. In logistic regression, as with linear regression, you have to have a single or multiple predictor variable. Predictor variables can be categorical or continuous. In logistic regression, we predict the probability of the outcome occurring given known values of the predictor. The results are an exponentiation of the B coefficient. Here are some examples of what logistic regression looks like. If the odds of a patient who has cancer also having pain is probably 5 times higher than those of a patient with no history of cancer. So we display our statistical results in tables and graphs. It summarizes the data. A table is the simplest way to summarize data, and they're presented as an absolute number or percentages, whereas a graph or a chart is a visual representation of the data, presented as an absolute number or percentage. Here's some basic guidance to summarize data. Ensure the graph has a title and label the components of your graph. Indicate the source of the data with a date and provide the number of observations as a reference point. Add a footnote if more information is needed. Table frequency distributions usually have sets of categories with numerical counts. Here's an example. Tables can also have relative frequency. Here's another example. The year, the number of births, and the relative frequency of it occurring. As you can see in the third column, all of that adds up to 100%. Also, here's an example of percentages of births by decade. And then in charts and graphs, they're usually used to portray trends, relationships, and comparison. The most informative are simple and self-explanatory. Here's a histogram. Use the right type of graphic depiction. There are bar charts, which are comparisons of categorical data, line charts, which display trends over time, and pie charts, which show percentages or proportional share. Here's what a bar chart looks like. And here is a percentage of new enrollees tested for HIV at each site by quarter. The descriptors in the titles and the headers and footers are very self-explanatory. So here you can look at, has the program met its goal? This is the percentage of new enrollees tested for HIV at each site by quarter. There are also stacked bar charts. It represents components of whole and compares the whole. So you can see here the number of months the female and male patients have been enrolled in HIV care by age group. And here's a line graph. It displays a trend over time. Here's the number of clinicians working in each clinic during years 1 to 4. Often, this is used in quality improvement projects. Here are the number of clinicians working in each clinic during years 1 and 4. See how well the labels help you understand what is going on within this data. And here's what a pie chart looks like. It's a contribution to the total 100%, or the percentage of all patients enrolled by quarter. You also have to learn how to interpret your results. Interpreting data is key to understanding what your QI project means. It adds meaning to the information by making connections and comparisons and exploring causes and consequences. The relevance of the finding, the reason for the finding, considering other data, and then conducting further data collection or research if needed. So interpretation is the relevance of the finding is adding meaning to information by making connections and comparisons and exploring causes and consequences. This is where critical thinking is important. Does the indicator meet the target? How far from the target is it? How does it compare to other time periods, other facilities or locations? Are there any extreme highs and lows in the data? And then, possible causes. Supplement with expert opinion if needed. Others with knowledge of the program or target population may be able to help you interpret the findings of your QI project. Consider other data. Use routine service data to clarify questions. You can calculate nurse-to-client ratio, review commodities data against client load, or other things. Sometimes you have to use other data sources. Like, for example, when we look at fall rates in the hospital setting, we always benchmark it to NDN-QI fall rate data nationwide. There's also situation analyses and demographic and health survey and performance improvement data that can be used from other units or practices or patients to compare to. And then interpretation, you have to decide if you have a data gap and need to conduct further data collection to be able to interpret and understand your results. It depends on the questions being asked and the resources available. So the key messages are: use the right graph for the right data. Tables can display a large amount of data, and graphs and charts are visual and easier to detect patterns. Either way, label the components of both your graph and your table. Interpreting your data adds meaning by making connections and comparisons. Data are good at tracking progress, identifying concerns, but never show causality. Statistical software platforms are available at GVSU, both SPSS and SAS. Students should design project questions, compile data, and consider their data analysis plan. KCON has a graduate assistant to assist with analysis, and the Stat Center on the Allendale campus also has graduate assistants to assist with analysis. All statistical analysis should be verified with faculty. Thank you.